relevant for all economies, especially India and the ASEAN economies, to press the reset button, look at things in a different way, do things which we've not been able to do in the past. As always, a crisis brings opportunities. You all might have noticed in the Indian Union budget, which was announced 3 weeks back on 1st February, we've actually increased our healthcare allocation by 137%. It was already perhaps the world. Idea was not only to augment that, but also because pandemic, like in every country, has brought to the forefront the need for basic hygiene and primary health care, and how to address such crises in future. India's vaccination drive is on its way up. It is probably going to be the largest ever in the world, not only because of our population, but the rate at which we have scaled up supplies and planned inoculation of our people. Same time, India is also fast becoming the so-called pharmacy to the world. During COVID, as you all saw, we've supplied HCQ tablets to almost, I think, about 150 countries in the world. And that is a time when most of the countries had actually asked their pharma companies to stop exports and not to supply to anybody else. Likewise, other than HCQ, of course, a whole lot of pharma products have gone out of India to various countries, even in the last 1 year. And that is despite of some API sources. Last 1 year, in fact, I would say last months, these leaves are in the big pandemic on, let's say, today we make 50 E's every and supply that. So India and the whole world. To much but I would like to
Manish, we are losing you in between.
To look at okay, what application area of India and ASEAN. First, of course, starting from scratch, which is cooperation at the startup level between India and ASEAN companies. India, the startup ecosystem is very strong, as you all know. They're also looking at a lot of affordable technologies in healthcare sector, because it's also a need. Sourcing PPEs in India and becoming part of value chains within ASEAN and India, that is something which is going to make availability of healthcare products to our citizens very, very cost effective. And with ASEAN and India have, I think that's one area we should thirdly, India class hospital healthcare system as does to the ASEAN. At the same time, it also requires posting and education, right from the grassroots level. I mean, from medical institutions and vocational to be collaborations on digital technology specifically, because today telemedicine, medtech, these are going to be answers to medical care in the future, and it also reduces a lot of healthcare costs, especially when people travel from one country to another for medical care. With these solutions, most of the pre-operative and post-operative visits can be avoided, and in turn reducing the costs. My last point would be to look at alternate and traditional medicine. Like some of the ASEAN countries, India is very strong in Ayurveda. So that's one area we need to look at more deeply. As you know, both ASEAN and Indian countries and India are somewhat home to acceptance of traditional medicine. In fact, in this direction, we are organizing the Global Ayurveda Festival from 12th to 19th March, and you'll be hearing more from us for participation of your Ayurveda and traditional medicine sector there. Today, of course, we have companies participating in the exhibition. I think more than 50 countries. Gaurav, correct me if I'm wrong, but they cover the entire gamut of the healthcare sector, including medical devices. So I expect that they all will have a buyers from all over ASEAN. In addition, we are going to have a very interesting panel discussion following the inaugural, where I think our panelists will deep dive into a lot of these opportunities between ASEAN and India. Thank you once again for being with us today, and I wish all the exhibitors and visitors to the ASEAN Healthcare Expo a very good 7, 8 days going forward. Thank you so much. Gaurav, over to you.
Thank you very much, Manish. You rightly set the tone for today's webinar. Without going for the further delay, it's my privilege to now invite Mr. Anand Swarup. He's a Joint Secretary, FT ASEAN at the Department of Commerce, Ministry of Commerce and Industry, Government of India. Mr. Swarup has over 25 years of experience of working with one of the world's largest rail network, which is Indian Railway. He has a rich experience of handling trade issues, trade remedies, intellectual property rights. Uh, he also handled important trade issues, like NAFTA, India's trade relations with Latin America and ASEAN. He has been involved in the multilateral negotiations in the WTO and the plurilateral agreements like India, ASEAN, FTA, India, Mercosur. Over to you, sir, Mr. Swarup.
Thank you, Gaurav. Namaskar to everybody. Sri Manish Singhal Deputy Secretary General FICCI, Dato Ramesh Kodarmalji, Co-Chair ASEAN India Business Council, distinguished panelists, ladies and gentlemen. It's a pleasure to participate in this very important event. ASEAN is a valuable partner, a long-standing friendly partner of India. ASEAN is the central pillar of our Act East policy. And I'm sure the ASEAN India Healthcare Expo and Summit would be another milestone in the long and important journey of our partnership. Healthcare, as Manish Singhal mentioned, has become a very important issue in the world in view of the pandemic. In India, it is one of the largest sectors in terms of the revenues and in terms of the employment which it generates. India's pharmaceutical industry is also the third largest in the world. We have an export of around $20 billion to almost all of the countries. We are also the only country in the world outside the US which has the maximum number of establishments which are certified by the US FDA. On ASEAN, we were looking at some of the data. They have a healthcare industry of around $25 billion. The medical devices is estimated to be $8 billion annually. The WHO estimates the expense which ASEAN countries have on their healthcare is around 4% of the total GDP. That's very, very substantive. Of course, led by Singapore. ASEAN countries are also heavily investing on universalization of healthcare. So I think there are a lot of opportunities which exist between India and the ASEAN region. On the Indian side, as Manish Singhal mentioned, we have a very robust pharmaceutical healthcare industry. We talked about PPEs from almost negligible production to about 500,000 PPEs a day, from a very few ventilators to 30,000 ventilators, and that to low cost. So that shows the resilience and the reliability of India as a supplier of medical devices and pharmaceuticals. As Manish Singhal rightly mentioned, we also feel very humbled to be called the pharmacy of the world. We were able to supply medicines to 150 countries despite the requirement in our own country. And we hope that we will replicate the same thing so far as the vaccines is concerned. As Manish Singhal mentioned, the pandemic has also shown the vulnerability in terms of healthcare and how important it is for all countries to start relooking and reimagining their healthcare, making it much more accessible and making it much more affordable. So that's the key for most of the countries in the world. How do we make our healthcare accessible and affordable? And where I think a better collaboration between India and ASEAN would be very, very helpful. There are estimates that in India, the medicines, of course, are the cheapest in the world. In terms of surgery also, there is an estimation done by FICCI itself that a surgery in India is almost 1/10 what it costs in the US. So there are a lot of opportunities and there are a lot of complementarities which exist between ASEAN and India. And I'm sure over the few days, we will be able to build on those complementarities and we'll be able to come up with some collaborations and fructify them on the ground. On the Indian side, we have a scheme called Project Development Fund, where under that scheme, we are looking to collaborate with ASEAN CLMV countries in the ASEAN region. And on 2 projects we are currently working on. One is on development of a multi-speciality hospital in Cambodia. And second is also on a hospital in Myanmar. So these are also some of the opportunities which exist between the 2 countries. And I'm sure we'll be able to leverage the opportunities which exist. Manish Singhal rightly mentioned, Ayush or the traditional medicine is also one of the areas where we feel there is a lot of opportunity to collaborate. We are working with Philippines to have an MOU between PTAC, their organization, and Ayush, our ministry on traditional medicines, so that we are able to bring it forward. On the insurance side, of course, in the budget, we have announced that we'll be increasing the FDI limit from 49% to 74%. So that also opens some opportunities for the people in the health insurance sector. So before I close, I'd like to thank Vicky. I'd like to thank AIBC once again for giving me this opportunity. And I'm sure over the few days, there'll be a lot of deliberation and discussion happening between the industry, and we will be able to come up with some solutions to the problems which are being faced by India and the ASEAN region. So thank you once again.
Thank you very much, Mr. Swaroop. for the extremely insightful address. We all agree that the pharmaceutical and healthcare are key priority sectors where India and ASEAN can collaborate and elevate their ties. With this, I would like to invite Datu Ramesh Kodamal. He is a co-chair of ASEAN India Business Council and chairman Goldex Group of Companies from Malaysia to share his views. Datu Ramesh Kodamal is the chairman of Goldex Group of Companies dealing in textile and home furnishing. He is also the chairman of ASEAN India Business Council, ASEAN India Business Council Malaysia chapter, and the chairman of ASEAN India Business Council ASEAN. He is currently a council member of Malaysia Indian Chamber of Commerce and Industry, and he's also a member of Malaysia National Committee for Pacific Economic Cooperation. Over to you, Datu. Datu, you are, please unmute yourself. Datu, you're on mute.
Thank you, Gaurav. I think now you can hear me.
Yes, we can.
Thank you. Manish, first of all, I would like to thank FICCI. I think FICCI has played a very important role to organize this particular event for healthcare and Expo within ASEAN and India. I must also thank Anand Swarab on behalf of the government of India supporting FICCI and AIBC come forward with such an event. I think it's very timely, and I think that with such events coming on board, we will be able to work further. There's always something which we say that when there is something which we don't understand, some light comes to us, which we move forward. And the COVID is something, in fact, which will encourage reforms in ASEAN healthcare sector, opening new investment opportunities in the field of biotechnology, telehealth, pharmaceuticals, and other areas where health is concerned. I think this is something which we never realized, but during the COVID, we can see this happening. ASEAN members actually are slowly committing to universal healthcare system, which Indonesia having the largest free healthcare program in the world, covering more than 180 million people. So you see what is happening in ASEAN, and you look forward to see what India can do for ASEAN. I think working together is a great achievement. The region already spends close to 4% of its GDP on healthcare. So these amounts are quite huge, and we hope that with this amount going forward in our GDP, we can see that India can work very closely with us. And these are good things which are going to happen. ASEAN countries are slowly committing to universal healthcare systems, and these national health insurance systems have become a key driver in changing the behavior of ASEAN population towards health. So we are all concerned of health, and we can see things changing. This has resulted in consumers becoming more health conscious, additionally in demanding and spending more on healthcare services. The industry in healthcare grows when we have the consumer understanding that there is a need for healthcare. And this is happening in ASEAN, and it is more happening during the COVID period, and we see this actually brings a great advantage to our trading partners like India. Many markets such as Indonesia and Philippines have succeeded in implementing national insurance programs. Indonesian programs are considered the largest programs in the world now because Indonesia has got a population of 180 million people. So we can see things are happening. Virtually the whole of Thailand population is covered for primary and hospital care, and Singapore offers the most advanced levels of healthcare for its citizens, providing specialized treatment such as heart transplant and neurologic procedures. I think if you look at it, there's a lot of money being spent in ASEAN for healthcare. Medical tourism is something which I've always been looking and speaking about. Singapore, Malaysia, and Thailand lead the field in medical tourism sector, with 3 countries having about 100 joint commissions international, which we call JCR, healthcare centers combined. Being a JCI certificate is considered as the golden standard for patients in healthcare and safety. Foreign patients arrive in the region annually, providing a major source of income to private hospitals in ASEAN, accounting for some 40% of the revenue of the aforementioned country. Globally, the medical tourism, health tourism is worth about 28 billion, with nearly one-third or 11 million global medical customers or consumers traveling to Southeast Asia. So if we see 28 billion is spent on medical tourism, ASEAN is in fact picking up quite a bit of it. So we will understand that if we are working with India and India can collaborate with us in various areas in medical tourism, we will also move to a different level. Coming back, as was mentioned by Secretary and Manish on pharmaceuticals, the block of pharmaceutical industry is valued about $25 billion, accounting for about 2.2% of the global market in ASEAN. Generic drugs amount to the large percentage of the industry's revenue in this region. However, only a small number of manufacturers have the capabilities to manufacture active pharmaceutical ingredients, with the majority of this coming from China and India. So again, India plays a very important part in pharmaceutical industry to provide the ingredients for manufacturing. So ASEAN is definitely looking forward that how the businesses can work with India to bring a combination of efforts put in by ASEAN India to take this platform to a greater height. This will open up the region domestic players to increase collaboration with multinational life science companies to serve the local market. Business more flexible as the use of multi-channel marketing sales such as e-commerce becomes a new norm. We are looking at technology coming into play where healthcare is concerned. So I think India is a perfect platform to work with, and ASEAN is there, and we need to really think about it. I think FICCI, the government of India, other companies from India and ASEAN are already looking forward, but there is a small hitch here. How do we go about it? How do we promote this? How do we really see to ourselves that ASEAN and India can take a step forward? Then there's another great thing which is coming up in ASEAN where India can work. That is medical devices. According to BMI research, ASEAN medical device industry is expected to see and generate more than 8 billion in revenue in 2021 this year. So medical devices are another area where we can look at seriously. In 2005, the bloc was established, the ASEAN Medical Device Directive, which we call AMDD. As a setup of this directive, the aim to harmonize the regulations across the region and to require medical devices manufactured to register their devices in any member state where they have production. So ASEAN has already worked on that. So the devices are not only manufactured in one ASEAN country, but throughout the ASEAN country. You have Vietnam manufacturing these devices, you have Singapore, you have Malaysia, and Philippines. I think all ASEAN countries are working towards a common platform where we can create another impact on the medical devices. So far, Singapore, Malaysia, and Indonesia have compiled with AMDD. So I think this is something which we look forward to. We have medical devices coming up, pharmaceutical industry coming up, and also the medical tourism. The opportunity in medical device industry is very depending on the development of such economic. Considering this product, stagnation is the most important strategy for individual markets. So I think if we can collaborate with India, because I believe that India too is working towards this medical devices, and if we can find some good partners from India to establish a teamwork between ASEAN and India, I think this is another sector we can also look forward. Chronic diseases such as diabetes cause a very unhealthy lifestyle are becoming more prominent in ASEAN. New solutions including the use of robotic surgery, 3D printing, All these are the additional things which are coming into healthcare, new technology, new innovation for prevention, which is rapidly transforming the industry. So what we are looking at one area is, we know we have got a problem, we know the COVID was there, and now we are saying that we are coming out of it and we are moving to a different level. We have got technology coming into play, we have got medical tourism coming into play. So this is something which is great. If you are talking about the health industry 3 years ago, we were just looking at what we could do, whether we could manufacture the pharmaceutical industries and things like that. Now it's becoming a wider range. So I think the entrepreneurs there in India and in ASEAN have got a great platform to play. So it's coming, there's a change taking place, and this change must be accepted. And while accepting the change, I think we businessmen who are here on this platform today, we should be forward looking to see what opportunity do we want to get out of this. Opportunities are always there, but how much can we go forward and work? And I think FICCI is playing a very important role here to see that how their members can work with the ASEAN counterpart, and ASEAN, we in ASEAN are also looking to see whether we can take this platform forward. I think the Ministry of Trade is always there to help us, and there's never been a time when I've spoken to the Indian ministers or personnel from the ministry. They've always welcomed ASEAN and have told us that please come forward and tell us what you want. And this is the same thing which I'm passing a message across to my Indian counterpart. Please let us know what we can do for you. We might not be in that business, but we will be in the connection to get things done. I might be in textile, I might not be well versed with the medical industry, but still, as the business acumen, we can see that there are things happening. We can get forward to get it done. That is my message which I want to pass to all of you today. AIBC will always be working forward to see the development between ASEAN and India, strengthening its relationship and moving forward. We are now looking forward to see that how we can restart negotiating the ITICA, the ASEAN-India Free Trade Agreement, and Malaysia being the main chair to do this. We are already moving with our ministers, and I'm sure, Sarup, you will be getting some good news from our side to see that we are taking this agenda forward. And I hope that today's event will be a great success. Might be, sometimes it's said, might be when you don't have the numbers coming forward, you have the interest behind the numbers when people talk about it that this has happened. So today's expo, today's meeting which we are having, today's speakers which we are going to have from ASEAN and India, I think this is a great start for the year 2021. So they usually say the Chinese year, the bull starts working harder. And the bull has already started working. And I'm sure when we come to 2022, the year of the tiger, we will roar and we will win. So good luck to everyone. Hope that we meet again very soon. Thank you, Manish. Thank you, Gaurav. All of you there, my dear friend Shanti, my dear friend from Malaysia, from what you call that, Philippines. My dear friend Rex, I can see him there. All the best. God bless you all. We will meet again. Thanks. Bye.
Thank you, Datu. Thank you for your very, very encouraging words. And as usual, a lot of tasks for me and my colleagues at FICCI to deliver, and we are determined to deliver it, forward. And before we end, the inaugural part of this particular webinar, so as I request, we basically, take you through the virtual tour of our exhibition, because we have organized the exhibition, so there are Indian companies who are participating at the exhibition. So I request my colleague Ayush to take us through the virtual trip. Ayush, over to you, please. Ayush, if you can unmute yourself.
Thank you, Gaurav. Good afternoon, everyone. Allow me to take everyone for a quick virtual tour of our India ASEAN Healthcare Expo. One visitor the exhibitor key in the login password, login ID, they enter the main exhibition lobby or the convention center lobby of FICCI. When you click on the exhibition, there are multiple lobbies created based on the events. So today, allow me to take you to India ASEAN Healthcare Exhibition. Now we are in the India Healthcare Summit lobby. Hall 1 is dedicated to the healthcare participants. Once we are in the exhibition lobby, we have multiple companies listed here, and there are 58 companies in this lobby which can be searched by using the cursor on the right. And there are multiple fields to communicate at these stalls which are available. That is chat option, video call, exchange of business card, and there is a gallery for the participants to show their collect products and services. And this is how the exhibition is placed. Thank you.
Thank you very much, Ayush. So with this, now we have come to the end of the inaugural session. And once again, I would like to thank Mr. Anand Swarup, sir, the Joint Secretary of Department of Commerce, Ministry of Commerce and Industry, joining us and sharing his thoughts and giving us a special address. Thank you very much, Tatu Kodamal, for joining us. Thank you, Manish, for joining us, and thank you, our MOU partner from Philippines, from Indonesia. And thank you, officials from the Indian mission in ASEAN and ASEAN missions here in Delhi. Now, this is time, we can enter now for the panel discussion, which is there on the new era of partnership in healthcare, telemedicines, health tech, medical device, pharmaceutical, and affordable healthcare services. The panel discussion is going to be moderated by Mr. Lalit Mistry. He is a director, healthcare, KPMG India. KPMG India. He will moderate it. Lalit is a director with the healthcare team of KPMG India. He has over 17 years of experience working in India, Kenya, Singapore, and Middle East with a range of government hospitals, medical device companies, health insurance providers, and international development agencies. Lalit's core area of work includes public health, advisory, PPP, healthcare infrastructure development, strategy, operations improvement, due diligence, project management, and health IT. So I request Lalit to please take over and moderate the panel discussions. Over to you, Lalit, please.
Thanks, Gaurav, and it's my pleasure, and thank you, Fiki, for inviting me here in this very interesting summit today. And it's my pleasure. It was great hearing Mr. Anand Swarup, Manish Singhal, and the Ramesh Kodamal. You have laid very good foundation of our discussion, which is very interesting. We've been here in this entire COVID-19 pandemic crisis since last 1 year, and I've been working with some of the public and private sector from last 1 year on the ground to how to see how the changes and what we could contribute in this entire crisis management. And the few things that we have learned during this last 1 year is that the change is part of the law of nature, and that applies to the healthcare services also. Today, the way you operate your healthcare services is changing very quickly, and you need to quickly adapt to the newer business models, newer technologies. Some of the innovations that was knocking the doors of the healthcare sector from the last 2 decades, whether it is telemedicines, whether it is virtual healthcare, whether it is big data analytics, and more of remote health management services. All of this, came into an forefront of our COVID-19 crisis management as an important tools and part of the healthcare sector deliver healthcare services at the times of such crisis, where the infrastructure based delivery became a challenge in this crisis. And I think there's a lot more learning for us. Increasingly, this crisis have have shown us that we need to expand our healthcare sector and incorporate digital technology, newer solutions. But not only that, we look for the larger partnerships across the value chains and across the borders, which is very important element today. In crisis, we quickly learned what other countries were doing, how we could exchange what the other countries' capabilities and could contribute to us, and significantly vice versa. India looked at developing, the HCQ tablets, looked at developing the vaccines and various other solutions, and similarly, India quickly adopted what was happening across the globe in terms of the digital solutions, the innovative ways of responding and managing the pandemic situations, whether it is a digital health, remote health monitoring, a Bluetooth enabled surveillance system, and so on. The entire partnerships came across the entire value chain and across the borders, and which was a new era, I would say, of in healthcare sector in coming together and looking at a partnership as a going forward future model and expanding the entire value chain of a healthcare services beyond the healthcare infrastructure based delivery systems. And today we have both patients, policymakers, and providers who accepts, adopts, and acknowledge the importance of the digital health and data enabled healthcare services as a core to the healthcare system now. And I think which is a great opportunity for us to imbibe on this entire digital health journey, look at the innovative solutions that digital health, remote health monitoring services, big data analytics, artificial enabled predictive disease monitoring, and a lot of other solutions that are coming up are going to be forming part of the core delivery part of it. And we see an increasing investment in these areas, both from the government side, providers side, as well as from the patient side. Today, patient acknowledge the importance of of rural healthcare services, and that is becoming very important in moving beyond the infrastructure or institutional care and going to individual health management or a population health management, taking the healthcare services closer to the community and to an individual is going to be the key going forward. Already we see over here, and we see that entire digital health technology play a very important role in delivering the healthcare services. Today we have a very panelists with us across the country, across the value chain, who are going to share experience with us in digital health solutions and explore the new era of partnership across the value chain and how those solutions and the partnerships and help us to deliver the healthcare services, and what is the future of this entire partnership that's going to redefine the healthcare services, the way healthcare sector is defined, delivered, and invested in coming time. I have my first panelist, Joyce. Joyce is the founder and president, Healthcare Group Company. Healthcare is a central source on the international healthcare management, medical and wellness tourism, and retirement industry in Philippines. It provides training, workshop, research, communications, and services on the globally accepted standards. I think it will be good to hear her from the perspective that what role can telehealth and digitization can play to instill a sense of safety among patient and health professionals. But digital health is something where there's always apprehension of providers as well as not safety and a sense of connecting with the provider and patient. How has been her experience around this, and what are the learnings for other countries from this work that she has done? Joyce, over to you. Joyce, you are on the mute, I guess. Joyce, I guess you are on mute. Gaurav,
Yeah,
can
you
you
can
hear?
remove the earphone and try. You can remove the headphone and try.
Am I audible? No. Yes?
You are.
Okay.
Yes.
Thank you. All right. Again, thank you, Mr. Lalit, and good afternoon from the Philippines. I'm deeply honored to be part of this forum. Thank you to Globis, FICCI, the Ministry of Commerce and Industry of India, Mr. Anand Swarup, and the ASEAN India Business Council led by Dr. Ramesh. For many years, the ASEAN region and India have been exploring avenues and forging partnerships in various ways. And I have been a witness to that for more than a decade now. Specifically in the healthcare sector, the pharmaceutical business was what our country and India have been strongly working together on with the introduction of generics medicine in the 1990s. Later in around 2010, we also worked on the adoption of India's NABH accreditation standards in our hospitals and clinics to upgrade our level of care and meet the global standards in the healthcare delivery, which is similar to JCI, as Dr. Ramesh mentioned, as we saw the opportunities of medical tourism. In fact, we were even able to adopt medical tourism or healthcare travel and social causes when we started bringing some indigent patients to India for highly specialized procedures like pediatric heart surgery and transplants as charity initiatives with the support of the ambassador of India. Now, with the COVID 19 pandemic, we are looking at more ways how our countries in the ASEAN and India can work together by capitalizing on each other's strengths of technology, people, and skills. Aside from pharmaceuticals, and of course that includes vaccines, we are looking at India's highly specialized skills on information technology to drive our telehealth capabilities, as well as the medical devices that will enable it. Also, technology that will help us to gather and monitor data that will help us in managing not just this pandemic, but the emerging infectious diseases, such as the global threat of antimicrobial resistance, which since 2008, WHO has already projected to cause about 50 million deaths around the world in 2030 if we don't do anything about it. So we need to invest in clinical research to develop new antibiotics, among many others. Through this forum, we are hoping that we could create more linkages between our country, with our 110 million Filipinos, and we're now preparing for universal healthcare this year. And together with the rest of the 673 million people of ASEAN and India's 1.4 billion people, that makes us 1/4 of the entire world population. So there are several vast, huge opportunities before us on the one hand, and limited resources, scarce resources on the other hand. And so we need to create policies as well that will enable these opportunities and regulations as well that will govern and drive them and not restrict the flow of trade and commerce and partnerships that we should, it's something that we should all endeavor in order for us to achieve them. So I think I'll end with that note, and thank you very much, and I look forward to an interactive and engaging discussion with all of you.
Thanks, Joyce, and very valid point made. And we have our next panelist, Mr. Siddhartha Mishra, who is a business leader and co-founder, Global Executive Healthcare Strategy, IT Transformation, and AI, based out of Malaysia. It will be good to hear from him. Although the health tech startup have really contributed a lot in this entire pandemic management, in terms of coming out with innovative solutions, bringing out those, the gaps that exist in the today in the healthcare systems. But how do you see the future of the healthcare startups and the innovative technologies, especially from the perspective of, investment, incubation, and larger acceptance of such innovative solutions and startup? And what is the future that you see, and what we need to do to support them and make them a part of a larger healthcare value system?
Thank you, Lalit. A pleasure to be here. Thank you so much, Vicky and Indonesian Healthcare Expo team. Thank you, Dr. Ramesh. It's truly exciting time, Lalit, if you ask me. If you look at the innovation in health technology that is going around all across the world. And one of the very interesting news that hit all of us in the start is we are one of the major company who works in chronic care management based out of US called as Levango. got merged with Teladoc, which is a telemedicine consultation company, with about 18.5 billion in the merger deal. I mean, that itself ticks off a very important step for remote health management as far as the healthcare industry is concerned. As we move forward, the conventional healthcare model and the hospitals have to move away the chronic care, long-term cases or rehab cases back to home to reduce the cost and efficiencies and make it more an acute care setting. This would help hospital to make more business and profitability, and this would help these patients to reduce cost and get the healthcare delivered at comfort of their home. Now, in terms of investments all across, the PE war chest has been open. Private equity companies have been going around and investing in Q3 2020 about 24 billion in health tech industry innovation and new growth startups. That's a lot of money. In fact, in India, we had about 40 million spent across 8 health tech companies. 3 companies got IPO listed. So as far as business is concerned, I think health tech, remote healthcare management, and patients sitting at comfort of their home and managing their diseases by interacting with doctor over a telemedicine platform is the way healthcare is going to move forward. There's no doubt about it. I think as far as India is concerned, and I'm representing an organization called as Hathi International, and we have been in Malaysia for last about 6 years and trying to develop quite a lot of cutting edge solutions for healthcare, looking to chase business all across Southeast Asia and India. So if you look at it, Lalit, I strongly feel that this remote patient management is going to be one of the key drivers of healthcare technology. Whereas you will see a lot of interest has suddenly developed on mental healthcare space because of COVID. COVID has actually cut off us as an individuals from the community, and that has led to a lot of mental pain and agony and depression. So that's another thing. And I think India is very well nurturing the concept of family doctor, which is going to be a massive business as far as Indian economy, Indian healthcare is concerned, because family doctor is the one which is close to the patient, which is there in the last mile, which is there at your doorstep. And I think that's where healthcare technology is going to be massive and is going to hit all of us. So that's an input from my side. I think health tech funding is all-time high. Incubations are all over. Telemedicine, teleradiology, teleconsultations, chronic healthcare management is all going on. We still have to see that how teleconsultation shapes up after the COVID period is over, because patients still want to touch and feel the doctors in the hospitals. But it's an exciting time. Exciting time. Thanks, Lalit. Back to you.
Thanks. Thanks, Dada. And very rightly said, we have seen some of the trend in, especially in India, the moment the lockdown was eased and, the life was getting normal, patients started and preferably, wanted to go to hospital again for a face-to-face consultation. But I think, yes, this will require some period of time for the patients and the providers to, start accepting, digital health and the newer ways of delivering the healthcare services. But yes, it's going to be around. It's a future. It's going to be forming part of the future healthcare value chain system, and we see a bright future for this. And not only in terms of the investment, but also contributing in creating and bridging the gaps that we have today in the healthcare system across the globe. Yeah, we have our next panelist, Ms. Shanti Shamdasan. She's a CEO and President ASEAN International Advocacy and Consultancy Private Limited, and she also has Sanyaka Med Consultant, a second opinion online medical consultation platform, and she's been working in this space. It will be great to hear, Ms. Shanti, about your experience, especially around the digital health part of it, but coming from the perspective that one of the concerns with the digital health platforms and the telemedicine is that the health data is considered as pretty sensitive, and one of the hinders in the larger adoption across the value chain. So what's your experience and what recommendation that you have and your experiences working across the globe?
Right. Thank you for that, Lalit. Good afternoon, everyone. And thank you, FICCI and Ministry of Commerce of India, ASEAN India Business Council, Dr. Ramesh, Manish Ji, and distinguished ladies and gentlemen. It is actually an interesting topic because, we have here Dr. Sidhu, who is our affiliates. We have a partnership with the Apollo Hospitals. And we implanted a business last year on second opinion healthcare consultation. Now, the business actually started quite well. There was a very good acceptance within the patients. But what has happened was there was issues around data privacy. The government started in Southeast Asia started talking about data privacy and how important it is for us, not as a patient, but as a general public, to secure or protect their data. So this has somehow brought back the attention of the patients to a certain extent that, okay, I have to be very careful in terms of providing my medical records and things like that. Now what we are now at a stage where government have actually stopped very, what do you call that, an intense medical health consultation that requires intensive or extensive exchange of medical records and data. So now what we are doing currently with the Indonesian government and some of the governments in Southeast Asia is that we are working with them to shape the regulation and policy of data security. With regards to non-second opinion, with just having cough and fever and cold and just picking up the phone and having an online consultation, getting antibiotics and whatnot, that is still ongoing. But for more serious cases like kidney failures, which I think Indonesia is one of the largest increasing in the kidney failures patient, renal issues, heart issues, this requires a big amount of data, which sometimes, number one, the patient don't keep the data with them. They're not very diligent in keeping their medical records. They leave it up to the hospitals. Number two, the hospitals sometimes are reluctant to share it because they are afraid that they will be bound by the data privacy. And of course, that is the case because data privacy is such a sensitive issue. Not forget about hospital. Even if a doctor go in and tell my friend or share with my friend, I gave Shanti X amount of medication, or she have got X medical issues, that in itself is a data privacy breach. So I'll just take a few minutes because I have only 5 minutes. So I'll just take a few more minutes to share with you what are we working on with regards to the Indonesian government in shaping the data privacy for patients. For example, we need to work on ensuring that we need to have patient consent in the following situation. Number one, if it is in the patient's interest. Now, what COVID have actually taught us is that if patient had shared their data more willingly, maybe R&D research firm could have come with the vaccine more sooner because they have the existing data to work on. So that is what we need to look into. Companies are not sharing patient data out of just for the fun of it. They are sharing company patient data because there is a much more bigger objective behind it, which serves the public safety, which serves a more bigger social issues. So patient needs to be able to have the consent if it is in the interest of the patients. If it is for healthcare purposes, I mean, if you want to sell the patient data to a bank or to a credit card company or to another clinics, then that's of course a breach of the data privacy part. But if it's for pure healthcare purposes, I think myself as a patient, I would willingly want to share my data because it will help me in future if there is any other viruses or diseases, at least if I willingly share my data, it will help me to get back a better cure in the future. Number three, if it is for public interest, again, I mean, look at COVID-19. COVID-19 is actually a public interest case. And again, the held up on data privacy have actually, I've talked to a few R&D company, and they said that we don't have enough data to work on. So it took us a bit more time. And they don't have the relevant data to work on. If they had the relevant data, that means the data of today, things would get expedited much further. So public interest should be something that will be put above patient interest, because patient interest is just one person and public interest is the interest of millions of people globally. The next one would be the patient data in the field of employment, social security, or social protection. Again, this is a very important part because we need to understand, I mean, governments need to understand, whether they are able to render social protection and social security for the collective, for the masses, not just for one or two people. And of course, for legal claims, I mean, if you have a dispute with the hospital, if there's a malpractice and the court, the case gets driven to the court should be able to access all of the patient's data. Now, currently, there is a big confusion on when to share, when not to share. The doctors themselves are a little bit reluctant, and the hospitals are very closed off to that. So even if it is the government that is asking for patient data, nobody is willing to give. The Ministry of ICT, for example, wanted to have patient data so that they can really target in terms of which area is where the COVID-19 is more higher, and they want to know which hospitals and all that, so that they can work with the other third parties to ensure that the correct information is disseminated. He was not able to get that data because, again, there's a data privacy issue there. So what we see here is that I think Dr. Ramesh did mention that there is a big opportunity, a big appetite in Southeast Asia for healthcare growth, no doubt about that. But out of my own personal experience, we started a business and then we got stopped because everybody's now talking about data privacy and how come a company can have access to the data privacy and whatnot. So this is something where the government has actually brought us to the table and said, okay, let's sit down. What do you have in mind? Let's talk about it. So this is what currently we are doing. There will be a lot of more few derails into this thing. And I think it was Sid that mentioned earlier that even after COVID, patient would want to go to the hospital. They would want doctors to touch them, to see them, in order to give them that confidence of diagnosis. That is still there, especially in countries in Southeast Asia. In a more developed countries, maybe that's not so the case. But in Southeast Asia, especially if you're talking about second opinion, they would want the doctor to see them because they feel that second opinion, they're experiencing a much severe disease, and in order for that to happen, they will have that emotional connection with their doctor and they want to talk face to face. So we still see that, but going digital, I totally agree that the future is in the digital realm, although it will be divided 50-50. It's just how you go around the regulations and how you go around working with the governments to make sure that what you are doing is actually in the general interest of the public. So to end with, data privacy will have to prevail in future. Otherwise, public interest and public security or social security will be kept at threat because the viruses will continue to evolve. And today we are able, some countries are able to manage the COVID, but in future, you never know what you're going to face with. So I'll end with that and return back to Dr. Thank you.
Thank you, Doctor. Thank you, Shanti. And very valid point. The data of an individual contributes to entire population health management, and which becomes very important in overall health management, especially during the time of this crisis, and also planning the health system for the future. But however, having said that, the data privacy and underlying regulations and the policies need to be framed to ensure that we have data security and data exchange seamless across the value chain, and basis on which we can build a larger and wider digital health system implementation across the value chain. We have our Dr. Harinder Singh Sidhu, who represent Apollo Hospitals. He's a VP Corporate Development and Head International Relationships. Apollo Hospitals has worked very closely with the governments in terms of building the capacity for the vaccine storage, creating the isolation wards, and working on innovative technology solutions to support the government and the patients during this pandemic time. It will be good to hear him in terms of his experience at how the pandemic has changed the healthcare delivery models, and how are we looking at the hospitals of the future, especially around this crisis and the entire digital health innovations and the data privacy, as well as it looking for a larger collaboration across the value chain, how the hospitals of the future are responding or will look like in coming times.
Thank you, Mr. Lovett Mistry. Thank you, Fiki, for this opportunity. Good afternoon to everyone, the esteemed panelists, Mr. Dato, the co-panelists and business leaders. It's a great pleasure for me to be here and hearing this interesting discussion on the digital platform. And I would say this is an opportune time to discuss. I love the topic which says new era of healthcare partnerships. For some of our colleagues across the border in different countries, I'd just like to share, just 3 days ago, there was International Regional Forum where our Honorable Prime Minister Shri Narendra Modi ji highlighted the spirit of collaboration in healthcare specifically, how the countries in the neighborhood have come together to help each other in this difficult time. And he actually announced some very good ways to see how we can build this further, including issuing special visas for nurses and doctors to travel during healthcare emergencies, models to see how we can see air ambulances in the region to help patients and others in the need. So this is just 3 days ago. So what just shows is the intent is at the highest level to build new collaborations. And we'll see more and more of this going forward with government-led initiatives and private health players coming in partnership to deliver the requirements. Just like the vaccine one, Apollo Hospitals is part of the vaccination drive of the government, where most of our hospitals are actually locations where the vaccines are being delivered. We are very fortunate to be part of this great initiative of the government. So we see a lot of collaborations coming in this way. And to mention about digital health, which has been talked about, and I've learned so much today, I'll just share the experience of Apollo on this. The concept of telemedicine has been existing for many years now. We as Apollo started the Apollo Telehealth Foundation in 2006. So it's been almost 15, 16 years on this platform. What has been different now is one, like was highlighted very briefly earlier by Mr. Lalit, is the adoption. Adoption by the clinicians, by the doctors to actually give consultations on the virtual platforms, and very importantly, by the patients to be actually satisfied with the virtual consultation. Yes, we are still in the traditional mindset of going to see a doctor physically, but we are seeing a change in that. And also a difference is the initiatives by the government. Right at the beginning of the pandemic, the government of India came up with guidelines for telemedicine, making it a very regulated framework, which helped all the doctors and hospitals and healthcare providers to make sure they can do this in a way which makes it feasible, practical, and without compromising any safety for the patient. So that was very helpful by the government of India. We've also changed some of our models. Apart from a telemedicine web-based platform, we launched an app called Apollo 24/7. It's a app based on your iPhones and Androids. The difference is in the last 15 years, we have touched 11 million lives on the Tele Network Foundation platforms and other health solutions. On this app, in 1 year, we have 7 million registered users. We have 4,000 specialists on this app, and a patient can access a consultation with a specialist within 15 minutes. we see an average of 2,000 consultations per day on this virtual platform. We have also added other services which were not there before, like you can actually order the diagnostics and somebody will come for home collection on the same app. And then after the prescription by the doctor, the medicines are delivered. We have fulfilled about 500,000 pharmacy orders on this app in the last 1 year. So we see a change in adoption, we see a change in delivery models, and we see a change from the government to make sure this is a regulated, and which means that the government wants this model to grow. So that's where from the technology platform we have had an experience. The other thing the moderator mentioned about how things are changing around the infrastructure. Again, it's not that this epidemic has happened for the first time. Obviously, at this scale, it is the first time, but we have incidences in the past like the H1N1, bird flu, and Ebola, which had a lot of learnings for a lot of us, especially hospitals like us, which have always been on the forefront. We have learned that we have to be very quick to adapt to different models. Just like especially we have to change our OTs, our wards, which can cater to specifically infectious diseases. A quick remodeling of your infrastructure is required. You have to come up with plug and play models. Now we are at in a way functioning where we can increase or decrease our capacity for infectious diseases like COVID within 24 to 48 hours. If we see a surge in infectious disease, we can increase our bed strength, and we have trained manpower. We have multitasking manpower to see how we can shift, let's say, an ICU nurse to a COVID ward as well. So these learnings have helped us to make sure that we are very adaptable and flexible to the need. The government of India is saying there needs to be an infectious ward permanently in all the government hospitals. So a lot of initiatives have gone towards infrastructure remodeling, and I would say adaptability as per the need of the hour. Skilling of manpower, upskilling is something very important. Again, we have seen an uptake on our online courses, which we offer through a vertical called MedVarsity. A lot of more people are now okay to actually come on online and have some contact programs limited, not as much classroom teaching as was required earlier. So we see a drastic change, and we are looking forward to see how we can contribute more to this change. And we are hopeful that the learnings from this pandemic will make us stronger and will be able to help us manage any further pandemic, which I don't hope is there, manage it better. That's all I would like to share. Thank you very much.
Thank you, Sidhu, and very rightly mentioned. Telemedicine and some of the innovation has been around for last one or 2 decades, but it was only during this pandemic time that the larger acceptance, adoption, and awareness that was across the value chain. I would say patient, providers, and the policymaker, and that's where we could see a lot of policies coming around that would enable the digital health adoption in the core value health system. And we have Dr. Lalit with us. Dr. Lalit is a co-founder of MedTel, which is again a platform they run, which is for a remote patient monitoring system and telemedicine solution. But also they have a very good presence and solutions in the IOMT solution, which enables in the remote patient monitoring and providing home healthcare and remote services. I guess it will be very good to hear him that how this pandemic times has really changed the remote patient monitoring and the telemedicine segment, and how do you see the future of or to strengthen and these two solutions and becoming a part of core primary care and preventive medicines in coming time? What we need to do and what has been your experience that will enable in terms of strengthening the solutions as a front door for the care system?
Thank you, Lalit. Thank you, Team Figi and ASEAN Council. So thank you, esteemed panelists. So we being a startup, so we at MedTel, we have presence for last 4 years, and we have made solutions for the whole telehealth and connected care ecosystems, and we are providing solution basically these even the small single doctor clinics to even the government run public health systems like PSCs and health workers. So in the post-COVID, I hope the all panelists agreed and all are saying that the adoption has increased. And the same case in we being a startup, we have done 20,000 patients at enabled 24,000 patient for teleconsultation through various our stakeholders like doctors, even NGOs, even CSR initiative. And also we having the solution for remote patient monitoring. We could monitor 3,000 patients through our remote monitoring platforms, and we provided to basically the hospitals. And to be honest, like in this COVID period, the need from the hospital side was huge, and every hospital was looking at some solutions they can provide directly, and it should be plug and play. So the most important thing what we learned, that there should be a solution where the insights that is coming from the platforms or the whole end-to-end solutions, it should fit to the need of the doctors and need of the stakeholders like patients and even the third-party payers, whoever. So the need is huge now, and what Siddharth was saying, like the investors are looking at this time seriously the health tech startups. So if you see in the fintech companies, like what they have done in the last 10 years, and how EPI played a huge role in delivering transactions in the rural areas, and that you can see now a pan shop owner or Golgappe owner. So he's having a UPI to make transactions. So in this scenario, what we see, the need is huge, and we need to enable like all stakeholders. I can say some of the numbers here. We have 24,000 primary health centers. We have around 150,000 sub centers. We have 9 lakh ASA workers in India. We have 10 lakhs, like 1 million retail pharmacy shops, 1.2 million Anganwadi workers, and 2 lakh other health workers. So those who for the rural areas. So those who really work on the rural areas, and we need to make them adopt digital health technology on the ground. I think if they will be having this technology in their mobile phone, so we are building some solution that is completely mobile, and it can really empower all the stakeholders, so that they can deliver services. So same as the fintech services, what I see, that everywhere there is a UPI and delivering services. The same way we can build solutions and empower all the stakeholders on the ground. So it may be public and private. I can say all pharmacy shops, we can enable 200 retail pharmacy shops, so that they are now empowered to provide telemedicine services. So it is not just teleconsultations, but we are providing telediagnostic services, which is completely connected care solutions, where there is the data sharing is completely streamlined from the patient side to the care provider side, the doctor side, the hospital side. So what we feel, that if we empower these health workers and those already existing health workers on the ground, and we give them technology, I think they can really bring an impact on the ground. So we, in this COVID time, we worked with both public partners and private partners, and we see a lot of responses from both from the providers and the patient side, and many other organizations like the corporates and all other organizations looking at remote patient monitoring solutions. So we have solution for specific, because we are disease agnostic, and we call ourselves a disease agnostic and device agnostic company. So we basically work with multiple connected devices or IoT devices. So we are building products for diabetes. As Siddharth told, that remote care monitoring and chronic is the future, and patients should do everything from home. So we have solution for diabetes, hypertension, then kidney care, then the pregnancy. So all the patients can now they can monitor from everything, and the doctor can get the real-time insights from the patient side, so they can take a clinical decision for the patients. So I think the opportunity is huge and the time is right, and we all being in the stakeholders as the government also willing to bring the change. If you see in the Ayushman Bharat, the government is trying to a lot of things in implementing, converting the sub centers into telemedicine centers. I think these are opportunities, and we all being a stakeholder, so we need to explore it, and we being startup contributing, and again we are also got to see by the investors in this COVID time through our work and delivery that what we did. So we got a funding through this after COVID, because the market was really willing to invest in healthcare. So, and also we could deliver in the other countries like Nepal, Bahamas, even Africa. We are providing solutions. We are talking to the few companies in Malaysia for few further collaborations. So there is opportunities. We all need to explore it. Thank you very much. Thank you all.
Thank you, Dr. Lalit. And yes, as you rightly said, it's a right time, and the entire environment around for the telemedicine and remote patient monitoring has been enabled, and everything is coming together slowly. And I think this COVID pandemic crisis actually provided that opportunity to put that ecosystem in place, which will enable the future, growth of telemedicine and remote patient monitoring and IOMT in as a core component of the healthcare value chain system in coming times. And yes, we have today with me Mr. Sudhanshu Sharma, who is the business head, Southeast Asia, Wokhard Limited, from India. Wokhard has been working very closely with the government in terms of the vaccine preparations and drugs manufacturing, and they've been working very closely. And I think one thing that we saw in pandemic is the partnership between the public and private sector and across the value chain. The pharma company rose to the occasion, and they started manufacturing on some of the drugs that they were not manufacturing earlier, or expanding their manufacturing capacities. In fact, even the non-healthcare and non-healthcare sector or pharma companies also indulge and started manufacturing PPE kits and the sanitizers and few other solutions which were very critical during those time of crisis. And I think it's a great opportunity that this kind of a crisis present us. You expand beyond your value chain, you create a newer value chain, you reshape your industry, reshape your partnership models, and that is what is required, and we have seen that. Mr. Sudhanshu, happy to have you here, and it will be good to hear you that how the Wokhard and your experience of the pharma industry, that how the pharma industry has rose to your occasion, what are the challenges and what are the future that you see in terms of strengthening the better partnerships within the various stakeholders in healthcare, but across the border as well. Mr.
Hello.
Sudhanshu, yeah, now we can hear you. Thank you.
Yeah, thanks, Lalit, for your introduction. Well, good afternoon, everyone. It's really a pleasure sharing this platform with each one of you. Thanks, Gaurav, for inviting me here. Before I touch based on how Wokhard and other pharmaceutical players, played a role in this COVID times, and how, so fast we have been able to do the manufacturing part of the vaccine. I would like to touch base on 2 points which two of our panelists to begin with has started, one by Mr. Manish and the other by Ministry of Commerce. Both of them insisted on how we can take the Ayush Ministry and our Ayurveda to the different geographies, more so when we talk of our ASEAN part, how we can do justice with our Ayurveda. So let me make a point here. Hello, am I audible?
Yes.
Hello.
Mr. Sudhanshu, we can hear you.
Yeah. Let me pick up. Yeah. Let me make a point here that when we talk of ASEAN, which majorly of countries like Philippines, Indonesia, Malaysia, Thailand, Myanmar, Vietnam, we still don't have a clear regulatory framework for the herbal medicines. The smallest of the markets like Cambodia and Myanmar, they are not accepting the dossiers prepared by India, and the bigger markets like Indonesia and Philippines, where they look forward for a very high regulatory approval of the manufacturing units as low as PICS countries. So most of the companies who are into herbal manufacturing, they are WHO GMP certified, and they don't have approval of key regulatory bodies, whether it's US FDA or TGA, Australia or UK MHRA, so on and so forth. So at one point of time, we need to see this, that how we break this big barrier when we talk of taking our herbal range of products, when how we can expand our Ayurveda kind of a thing, as put forward by two of our eminent colleagues in the beginning, to the various countries across the globe. So that's one point which I wanted to touch base. Second, when we are talking of pharmaceuticals and when we are talking of our vaccines part now, let me give you a brief background that the developing countries vaccine manufacturer network, which we call as DCVMN, has been in place for almost like 32 years. It's a collaboration of almost 41 manufacturers across 14 countries who are into this space and who are taking care of 70% of the world's vaccine market, more so in emerging countries. So the platform was very well in place. This COVID pandemic and when they collaborated across different geographies and across companies where it never happened in the past, it has given them that kind of a thirst, that how partners help them in meeting the world's requirement at a faster pace. A very fine example in this case is approval of Vocard's UK plant by the UK MHRA authorities, that whenever they are going to need, we have kept our two lines ready, and whenever the AstraZeneca Oxford vaccine they need more on the manufacturing side, our lines are ready. Same happened with the Sputnik COVID vaccine from Russia, who have partnered with Dr. Reddy's in India, and I think another sometime they are going to supply those across the globe. So I think the government needs to look into that, how they can support more and more. I mean, we are into biosimilar space, which not many countries and companies across the globe have been able to breaking through, whether in the range of diabetes with insulins, or in the range of oncology with a lot of MABs. Government needs to look into that how they can support the infrastructure which is already there, existing infrastructure across various companies in India, and which can really play a lead role at a global platform, so as to give panacea to the patients at large. So that's it from my side. Thank you very much. Thanks everyone.
Thank you, Mr. Sudhanshu. Very rightly said. The pharmaceutical industries will always play a very important role in this entire crisis and overall health management. And we have Mr. Sandeep Sur, who is a country manager, Heterodrugs, from Indonesia. Heterodrugs is one of the leading Indian pharmaceutical company who has been working very closely with the government. And he has a significant experience in pharma industry, especially around the Southeast Asian market. And it will be good to hear him from his perspective, that how the pharmaceutical industry collaboration should work across the borders, and especially with increasing demand for healthcare services, and also to mitigate any kind of a pandemic or a future health crisis. How do you see that partnership that should be explored, and what could be the very important drivers that will drive the collaboration across the borders, especially in the ASEAN countries? Mr. Sandeep?
Yeah. Am I audible?
Yeah, you are.
Okay. So thanks, Lalit, for introducing me here, and then once again thanks Gaurav for again inviting me for this FICCI meeting, and my pleasure to be here with the fellow panelists and of course the other distinguished guests. So Hetero is a strong manufacturing based company from Hyderabad, and I almost started this company along with my team here. I mean, it's a very small team, 4 years before. And I can say that Hetero has utilized its strength, manufacturing strength, in supporting the government here locally, especially for high value drugs like oncology or biosimilars, to bring down the price. And of course, that Indonesian government has initiated the universal health care, and the cost is one of the major issue. And for an Indian company, which has globally earned the reputation of, one of the top, more than 20% of the world generic production comes from India. And currently, maybe in terms of volume, we are quite big, but still the value is so less. And also the initiative from the government of Indonesia at a high level, with the President Jokowi visited India, and also our Prime Minister, Mr. Narendra Modi, 2 years back visited Indonesia to increase the effort. And one of the key direction from the government is to have a collaboration with the Indian pharma companies specifically. So Hetero has so far has played on its strength. Being a strong manufacturing company, we are able to provide the finished goods to the government here at a much economical price. And another important area which I see there is a lot of opportunity for Indian companies is the API, because Indonesian government import almost 90% or more than 90% of their raw material either from India or from China. So Ministry of Health has also taken several initiatives where they reduce the dependency on the API import. So that is one area where I see Indian companies can definitely step in and support the government here. And another important part is the high value products like biosimilars or oncology. There is a lack of R&D in this country, and Indian companies have a very strong R&D now because of a lot of good companies like DRL or Sun Pharma or Aurobindo. They have a strong R&D, including Hetero. So they can actually collaborate with the Indonesian companies and have a strong R&D base. And now you also get a lot of benefits if you have collaboration or locally R&D based in Indonesia, especially for government listing or even for specially tender. So I think R&D is one area where Indonesia is relatively I will say, if Indonesia, I am also talking about ASEAN countries. So India has the strength of manufacturing, has the strength of R&D, and also one area that is CRO, Clinical Research Organization. I think we need to explore these areas. Apart from, we have already established ourselves as a strong manufacturing company, Indian company, generic company, at a low cost, affordable price with the high quality product. We also know that we have the most number of USFDA approved plants in India. So the perception about the quality of drug and all those things, and I don't think so is going to be an issue going forward. What we need to support in ASEAN countries is maybe through R&D, API formulation, because most of the countries do not have the economy of scale to produce those API at local level, and they are dependent quite a lot on China and India. And even if you look at currently in Indonesia, API formulation, still majority of the import is coming from China. So these are the areas where Indian companies can tap in and also can support the local government. Of course, R&D is another area which is for long term, but for short term, of course, API finished goods, that definitely is going to support the Indonesian government. And of course, it will help to reduce the overall burden of, as we know that chronic diseases are growing, oncology, diabetes, hypertension. So these are long-term costs for the government. And when you adopt a universal healthcare system, then government has to, support that system for a long period of time. And there, Indian pharma companies can definitely collaborate our partnership in Indonesia. And I will say that Hetero has, you can say, very timely invested in the country, and we have been able to drive. One of the classic example, I will say that for oseltamivir and for remdesivir, we were the first one to get the remdesivir approval, and we collaborated with one of the largest company in Indonesia, and we have been able to supply remdesivir during the crisis. When the Ministry of Health was looking for remdesivir, Indonesia is still not under control. So we have been able to supply them remdesivir. We have been also able to supply them oseltamivir. Oseltamivir is also widely used for mild to moderate, for COVID. So Hetero has utilized its strength, manufacturing strength so far, but going forward, there are other plenty of opportunities, as I mentioned, API or R&D. Those are the areas where Indian companies can, definitely partner and support each other. Thank you.
Great. Thank you, Sandeep. And I will agree with you. In fact, the collaboration that we all witnessed during this pandemic in the last 1 year is profound and needs to be applauded. The various stakeholders who came together and supported each other in creating a very strong, robust response to this entire COVID-19 pandemic has been great, and we have seen a larger and newer partnership models emerging during this time, which has also expanded and beyond the traditional partnership seen in the last few decades. We saw a new partnership across the value chain, across the borders, wherein we could see the pharma, medical devices, digital health, healthcare providers, and various other stakeholders came together and work together to manage this entire COVID-19 responses. And going forward, I think there are two things: is constantly the healthcare sector will have to adapt the journey of the change, constantly adopt to the newer needs, and also look at the newer models and be open for the partnerships. And that is going to be the future of entire health system and creating a value, because entire thing is going to be entire focus has to be about the individual and the community health management. And the more collaboration and the partnerships that we drive, it's going to bring more value to the individuals and the entire population. So having said that, I hand it over back to Gaurav, and thank you very much to all my panelists. It's been pleasure having you all, and it was great hearing you, your great insight and your experience, and thank you very much.
Thank you very much, Lalit. It's been pleasure hearing all the panelists, their views, and thanks to you especially for moderating this very important session. What I request to all the panelists, during the day today or tomorrow or day after tomorrow, please do visit the Indian companies, who are exhibiting. You can always guide them, talk to them about the business, and we certainly look forward to have more similar sessions with your support, focusing on ASEAN in healthcare sector. As our Joint Secretary, Mr. Anand Swarup, rightly mentioned, the government is very much with us through the AIBC platform, through with the support of our MOU partners in ASEAN, in each country. We look forward to have more engagement in this particular sector. So I would like to thanks again each panelist, Ms. Joyce, Siddharth, Shanti, Dr. Haridra Sidhu, Mr. Lalit Ranjan Manik, and Sudhanshu Sharma and Sandeep to please join us. Join us for today's interaction. Have a good day, sir. With this, we are now coming to the end of today's panel discussion. Have a good day. Take care.
Thank you very much.
Thank you.
Thank you very much.
Thanks a lot.
Okay.
Thank you.